Our objectives for this week, we're going to talk a lot about different wrapping techniques, sterilization techniques, and really like what is the proper way to wrap certain items and how they can be, different items can be wrapped different ways. So that's really the focus for this week. Here are your assignments, a couple of small quizzes. You still have your workbook discussion like normal. So make sure you're getting those in because we're kind of getting here towards the end where you're going to start falling behind if you don't. So if you still have something that's missing, please get it submitted. There's still several who don't have a decontamination video in. So that will drop your grade significantly if you don't have that in. I promise you. Um, get it in. It's not that bad to do. Just work on it, please. So remember your discussion. A lot of you are still forgetting to respond to two peers by Sunday evening. If something comes up, you don't have internet, whatever, let me know. Send me an email, okay? And we can work through that. All right, so this week is talking about assembly and packaging. So how do instruments go from decontam to being used in the operating room? What is the step there? Because there's a lot of things that have to happen from this point in the circle of use back to being used on a patient again. There's a lot of things, very detailed things that have to happen. So once instruments have been sent through decontamination machines, like for example, the 3 sinks, the ultrasonic, they go to the clean assembly area in the central sterile processing department. So it goes through that washer, decontaminator, over to the clean side. So decontam is dirty, over to the clean side. And then they get organized into trays and then re-sterilized. So what are our guidelines here for pack preparation? Okay, a lot of facilities have what's called a count or a pick sheet. Sometimes they call it a preference card, whatever your facility uses, okay? That's how you know what each case needs. Usually it's digital anymore. A lot of places go digital. And you can print it, have it just right on each case card, each box, whatever it is you end up using, okay? So tray requirements are usually set by the surgeon or staff, usually like a combination of both. They get the input of, what the surgeon needs, what they want for each case, and then also maybe some experience with the OR staff. So, anytime a new surgeon comes in, they have to work on getting those preference cards set up for them. It can be an undertaking for sure, but it's really important to have good preference cards for everybody, not just for the surgeon, for the patient, for central sterile processing staff, everybody. Okay, just goes more smoothly if there's a good preference card. So all items are going to be dried prior to sterilization. So keep that in mind. After it's gone through the washer, decontaminator, they have to be dried before they can be re-put back into a sterilizer. Okay. The exception here are lumens, like for example, your Fraser Ferguson suction tip or Yanka or something like that. You do want a little bit of moisture left in the lumen so the steam can like work its magic, penetrate the inside of that lumen and kill those spores. So instruments are going to be inspected for cleanliness, functionality, damage, and making sure all the parts are present. That's part of like repackaging each tray or each individual package. Maybe it's a peel pack, okay? So instrument inspection is super important. I can't stress that enough because, a lot of times I see like maybe scissors that don't cut right. They're really dull and they just keep getting put back into circulation. They keep getting put back in that same surgeon's tray and they get really mad, okay? Because they get the same pair of scissors, the next day for the same case and they don't work. So it can become a patient safety issue as well. If you don't have the best for the patient, what kind of outcome are you going to get? You're not going to get the best outcome, right? So it goes all the way back to making sure instruments are inspected properly. And these guidelines must be followed. So, if you're one for not paying attention to detail or you like to cut corners, you may want to really think about that because this job may not be for you. We depend on good sterile processing staff to pay attention to detail. Patients depend on it, okay? So when we're talking about instrument holding trays, the trays that actually hold, an entire set of instruments, maybe for a thyroidectomy or a laparotomy. Okay, there's a lot of different trays for different surgeries, specific surgeries. So you have to keep these in mind when you're putting those trays together. You always, again, want to check your IFUs if you're not sure, okay? Don't overcrowd the trays. You might have to split things into 2 trays. For example, in our facility, if we're doing a laparotomy, we have a pan 1 and a pan 2, major 1 and a major 2. So the first tray is really most of your clamps, scissors, forceps, those types of things, scalpel. And the second tray are all of your retractors that you might need, like Richardson's, Army Navy's, Balfour, something like that is really what those are. And anything extra would just be in a separate tray. So it's just too much to put in one tray, so they had to separate it. Because remember, you also have to keep it under 25 pounds. 25 pounds is a lot anyway. It's a lot to lift, over and over again. So you want to make sure it's under 25 pounds. Also, you want to remember as you're packaging them or putting them neatly in the tray to protect the instruments from damage. You don't want to be putting like heavy things on top. You want to make sure your delicate tips are protected. Those are on top, those types of things. And then hinged instruments like your hemostats, Kelly's, Coker's, Alice, Babcock, whatever, are unclamped. Now, sometimes as you're stringing those back up on your stringer, they can become clamped if you're not careful. So just watch for those. Maybe do a final check right before you put the lid on. So those have to be unclamped so the sterilant, whatever it is you're using, can get into the ratchet as it's ratcheted. If it's ratcheted shut, it can't get in there. That's what I'm saying. So remember FAN here, this little acronym. You want your trays to be functional, accurate, and neat. So remember that every tray you do, those 3 things. With each tray, you also have to remember to put in a chemical indicator strip. Whatever your facility uses, this is one example. There can be a lot of varieties, different brands, different sterilizers require different strips as well. But this is your chemical indicator, not your biological, okay? The chemical indicator has to be in every single instrument tray or peel pack that you do. Has to be. As a surge tech, if you get one of these trays that doesn't have a chemical indicator, we can't use it. Because the whole purpose of this strip is to show that the conditions for sterility have been met. The conditions. Now, it doesn't necessarily mean 100% that it is sterile. The only way to do that, to indicate that it's truly sterile, is your biological. But we use this as a way of showing, okay, yes, all the conditions for sterility have been met. And unless our biological comes back saying otherwise, we can use the tray. So there's also going to be a different, whoops, sorry about that. There's also going to be a different type of indicator on the outside of like caskets, instrument caskets, if you can't see inside as well. So there's multi steps or even multi-levels. If your tray has a bunch of like little caskets inside of a big one, you have to have one on every single level, especially on the bottom. All right, so what are our packaging materials? If we're going to do like an envelope fold or something like that, what does it have to be made of? It is important to choose the correct packaging material for whatever it is you're wrapping, right? Otherwise, it may not render it sterile. So you have a woven type of fabric, and it's a 140 thread count minimum type of muslin. So that's what it's made of. And it needs to be 2-ply. You also have a rigid container, which is what we often call a casket. The rigid outer metal container that has a sealable but removable lid. Usually the lid is also steel or aluminum. They can be plastic. Usually, in my experience, there's some sort of metal with the inner instrument basket that holds all your instruments. And then you have peel packs, which can be a couple of things. So notice, they can either be a paper-plastic combo, and notice those are used for steam or ETO, ethylene oxide, okay? Or you could have a Tyvek type. So the Tyvek is going to be for sterilant or ozone. So with the paper plastic, notice the sterilant, whether steam or ETO, cannot enter through the plastic side. So keep that in mind when you go to position those in your sterilizer, that the steam or ETO can properly get inside the package as well as exit it. So here are the literal step-by-steps for wrapping an envelope fold. Now, some people can like read directions and it just clicks with them. Some people need to see it. So I put both on here. I prefer to see something, that's how I learn. I'm a visual learner, but some people really prefer to read it, but I like to summarize them as well. So here are the summarized steps for doing an envelope fold. I'm not going to read them all to you, but you're welcome to pause it and read those. But in the next slide, I do have a video, actually a couple, on how to do an envelope fold because this is something you'll do all the time. We envelope fold a lot of things. Now, this is going to be an instrument tray. If you don't use caskets, the hard like outer metal to hold your instrument trays, you might wrap it like this. Okay, so that's a pretty big instrument tray that you have to envelope fold. Notice it takes like a lot of coordination. Sometimes she uses her elbow, so it can be a little tricky until you get the hang of it. But here's another version of that with a different style of wrapper. This is called the Smart Fold wrap. It has like extra tabs that make it a little bit easier for you to do the wrap instead of having to use your elbows or, kind of lay on top of it. So watch and look for the difference here.
So, how does SmartFold work? Let's look at it once again, step by step. Select the correct size and grade of SmartFold for your tray. SmartFold comes in a range of sizes. Once you've laid out the wrap with the blue area away from you, position the tray for wrapping. Place the front edge of the tray at the reference line, not at the edge of the white area. Both sides of the tray should fall within the blue reinforcement zones. If both sides do not fit within the blue reinforcement area, select a larger or smaller size of SmartFold. Begin folding as you normally would, bringing the wrap up and over the tray so that the front side of the tray is covered all the way to the work surface. Hold the corner lightly and tuck and fold the side in as usual. Now pull the side tab up and over the top of the tray and secure it with a positioning strip. The strip will keep the tab in place while you complete wrapping. Repeat the process from the other side, again patting the side tab into place on top of the tray. Bring the outer ends of the flaps together, like this, or overlapping. SmartFold's ergonomic design features keep the fabric in place without elbows or awkward bending and twisting. Now, tucking the front corner slightly, reach over and pull the blue section up across the top of the tray. Note that the top section is less bulky for a nice, neat closure while still providing a full 3 layers of protection to the tray. Tuck the front and under, neaten the edges, and tape with indicator tape as usual. Now process your SmartFold package for sterilization, exactly as you would with one step. SmartFold has been approved for both pre-vac steam and EO processing. Finally, transport and store trays wrapped with KimGuard SmartFold, just as you do packages wrapped with KimGuard and KimGuard One-Step Wrap. Halyard Health offers a knowledge network education unit on tray handling through our Excellence in Sterile Processing series. Talk to your Halyard rep if you would like to.
So hopefully that gives you a good visual of the two that your facility might use one or both of those. I think it's pretty cool what they've come up with the smart fold wrapping system. It also makes it easier for whoever's up in the operating room, search tech, circulator, whoever, to open those with the same tabs that they used. You could see that there were two others that is going to help open that up sterilely in a way that, less likely to contaminate what was wrapped inside. So, I think it's beneficial all around for everybody. So I think a lot of facilities have kind of moved towards something like this as opposed to the old school traditional um, envelope fold technique. So just wanted to familiarize yourself with both
To
of those.
receive this program in your facility.
Okay, so let's look at a couple different identification of maybe wrapper errors, handling techniques, different types of tears, because it's pointless to, learn how to do all this if you're not going to store it properly, or you're going to get it off the shelf improperly in a way that might tear it. So you would negate everything you've just worked hard on doing. So you want to make sure that you've gotten this far, you want to make sure you can also store it and get it up to the OR properly.
Welcome to the Kimberly-Clark Healthcare Knowledge Network presentation entitled Sterilization Wrap, Tear Identification and Handling Technique. This is one of our Excellence in Sterile Processing programs that addresses critical issues in healthcare. At the end of this continuing education program, you should be able to list 3 factors that can compromise the sterility of a wrapped package, identify the types of tears that can occur in wrapped packages, describe the possible causes for these tears, and discuss proper tray handling technique that will assist in preventing these tears. After sterilization, factors that can compromise the sterility of a wrap package are moisture, soil, and physical damage. Let's review these factors. After the sterilization process, packages may become moist from causes that include touching sterilized packages before they are cooled, placing the package on a wet or damp surface, carrying the package tucked tightly under the arm where it can come into contact with the warm, wet armpit, or from handling the package with wet or sweaty hands. Sterile items that become wet are considered contaminated because moisture brings with it microorganisms from the air and surfaces. A second factor that can compromise the sterility of a package is soil, such as dirt, dust, and debris. This soiling may result from causes that include incorrect or excessive handling or from unclean storage facilities. A third factor is physical damage to the package. This can be caused by dropping the package on the floor or another hard surface, through rough handling and manipulation of the package, such as forcing it into a tight storage space, or by stacking heavy packages. Packages that are wet, soiled, torn, or dropped onto hard surfaces should be considered contaminated and unsafe for use. If there is any doubt about the sterility of the item, it must be totally reprocessed before it can be used safely. For the purpose of this program, we will focus on the third factor that can compromise the sterility of a wrap package: physical damage. Improper handling is a major cause of physical damage and contamination of sterile packages. One cause of improper handling and stress on the sterilization wrap is heavily weighted trays. For instance, as surgical procedures become more complex, so do the instruments and trays that support them. That often means that the weight of the trays has increased, making it more difficult for sterilization wrap to withstand the greater pressures of heavier instrument sets, especially when handled and moved improperly. Other examples of improper handling include manipulating wrap packages with long fingernails that can rupture the package material, inappropriate storage resulting in crushed, bent, or compressed packages, and dropping packages. Dropped packages should be considered contaminated even if no damage is apparent, since the jarring and compression on landing can force dust and airborne microorganisms into the package. The consequence of physical damage is often a tear or ruptured seals that could result in contamination of the tray contents. Physical damage will most typically occur along the bottom tray edges and at the corners. The following is a review of wrap tears. There are three types of wrap tears: cuts, holes, and abrasions. Several types of cuts may occur. A knife cut is almost always straight. The edges are clean rather than frayed and can easily be pulled together to make the wrap appear intact. A knife cut generally occurs on the top few sheets of the first bundle of sterilization wrap when a knife is used to open their packing box. At first glance, a pressure cut may look like a knife cut, but upon closer examination, one can see that the fibers around the edges of the cut have been welded or stuck together. The edge of the cut may feel hard to the touch. Pressure cuts may be seen at the perimeter or outline of the bottom of the instrument tray, or at the top of the instrument tray if trays are stacked on top of one another. Pressure cuts can be caused when all three of the following factors are present. The wrap is sandwiched between two hard surfaces, excessive pressure is applied, and the tray is pulled or dragged across a smooth surface. Another type of cut is a snag cut. The edges of a snag cut show loose fibers hanging from the edge of the cut and/or there are individual fibers spanning the width of the cut. The edges of a snag cut are not hard as with pressure cuts. In larger snag cuts, the shape of the cut usually resembles a triangle, with the point of the triangle being where the snag began. Snag cuts are generally due to the tray being pulled or dragged across a rough surface, such as is often found in an older, well-used sterilizer cart. If the tray is very loosely wrapped, snag cuts may occur along the edges of the wrapped instrument tray. They can also occur on other areas of the tray where the wrap is too loose and can be caught by rough surfaces, corners, or edges of objects. Holes are yet another type of wrap tear. A pressure hole may appear as a tiny opening less than 2 millimeters in length where the fibers around the edge of the hole have been welded or stuck together. They are usually found along the perimeter of the instrument tray. This type of hole is caused when the wrap is sandwiched between two hard surfaces, such as when heavy trays are stacked on top of each other. Or a pressure hole may occur when excessive and/or sudden pressure is applied. An example would be when a package is dropped on a hard surface. Another type of hole is the snag hole. This hole is triangular in shape with loose fibers hanging from the edges. A snag hole may result from the wrap getting caught on something, such as a rough surface or a burr on a sterilizer cart. A puncture hole is characterized by frayed or loose fibers attached to the edges of the hole. Typically, this type of hole will not have hard or welded edges. The most probable cause for a puncture hole is an instrument in the tray becoming loose and puncturing the wrap from the inside. If tip protectors are used and instruments are anchored appropriately within the tray, this type of hole can be prevented. The tiniest of holes is the pinhole. This is a very small hole that may be the result of physical damage in which a very small object pierces both layers of a wrap tray. Occasionally, a pinhole may be due to a manufacturing defect and can be seen on one of the sheets of wrap. If the pinhole is visible through both sheets of a wrap package, it is probably due to physical damage and not a manufacturing defect. Another type of hole is a melted hole. This is a large, round, or irregular hole with hard welded edges. A melted hole may be the result of the wrap coming in contact with a heat source, such as a hot instrument in a tray that hasn't been allowed to cool sufficiently, or contact with a light bulb in a storage area. Abrasions are another category of wrap tear. An abrasion appears as a fuzzy surface, sometimes dirty or discolored. It can occur when a wrap tray is repetitively pulled over a hard surface. Trays that are repeatedly handled prior to use often display abrasion. An abrasion hole is the result of extreme abrasion with holes in one or both layers of the wrap. The possible causes are the same as for general abrasion, except that the abrasion was repeated often enough to finally result in a hole. Proper tray handling technique is essential for preventing damage to the packaging and compromised sterility. Education and training programs should include information on proper tray handling technique. Continuing education should be provided at regular intervals to review and update worker knowledge and skills and to maintain their competency. All orientation on the job and in-service training should be documented.
I'll go ahead and stop it there. That gives you an idea of what to look for, when you're putting these trays on your case carts. Just give them a good glance over before you send them up to the OR. They're going to look as well. But, the more eyes you have on something, the better off you're going to be. So, in the operating room, the surge tech and the circulator are going to hold up those wrappers to the light to see if they can see any of those types of holes or tears. And if they do, we obviously can't use it. Remember, when in doubt, throw it out. So it'll get sent right back down to you. So just be mindful of those things. And, the more you handle something, the more likely it is to be contaminated. So we try to minimize how often we move things around, handle it, push it around, that sort of thing.
All central services personnel should maintain a high level of personal hygiene
Going
and
here.
should be wash or hand sanitizers used as appropriate.
Well, sorry about that. I don't probably hit the button one too many times, but it just kind of froze on me there. So if you have any questions, problems, feel free to send me an email, mludwig@herzing.edu. You guys are doing a great job so far. I really enjoy interacting with each of you. So reach out again. Any questions? Have a good day. Bye.